Good day, everyone. In this lecture, I will be discussing a cornerstone of patient centered care, the Patient's Bill of Rights. This presentation is not just a legal framework, rather, it is an ethical reminder that behind every diagnosis is a person who truly deserves our care, compassion, and understanding as nurses. The first right that we are going to discuss is the right to considerate and respectful care. The very fact that these patients come to us seeking our attention means that they need something, at least from a medical perspective. This means that every right, regardless of their background, their condition, their socioeconomic status, their religious or political belief, to be treated with courtesy and dignity. For us nurses, this translates into a small but meaningful action: addressing patients politely, ensuring privacy during care, and showing empathy even in busy or stressful situations. Respect costs nothing, but it can make a world of difference to someone who feels vulnerable, who feels pain, or who is afraid, such as our patients. The second right that we are going to discuss is the right to obtain complete and current information about one's diagnosis, treatment, prognosis in a language that the patient can easily understand. This means that we should never allow medical jargon to be a barrier in our communication with our patients. As nurses, we should ensure that patients and their significant others truly understand what we tell them. If a patient seems confused, we nurses should take a moment to explain these in simpler terms. When patients understand their condition, they become empowered partners in their own care. And this leads to better outcomes and trust in the healthcare team. Next, the patient has the right to receive from his physician information that is necessary to give informed consent prior to the start of any procedure or treatment. Informed consent is more than just any piece of paper. It is more than a piece of legal document that we incorporate in the patient's chart. It is ethical dialogue. It builds trust. It ensures openness between the nurse, the healthcare team, and the patient. It is our responsibility that the patient truly understands what will be done to them and why this procedure is necessary, and if ever there are any risks involved, and if there are any alternatives that are available to them. As nurses, we are the patient's last checkpoint of understanding. We serve as the bridge between medical terminology and human comprehension. The fourth right is the patient's right to refuse treatment, as long as it is permitted within the boundaries of the law, and as long as the patients are truly informed of the consequences of their refusal. Nurses have the obligation to respect this right to refuse. This right highlights the principle in ethics of autonomy. Even if we believe that a certain treatment is truly necessary for the patient, ultimately, the final decision rests with the person receiving care. Our role as nurses is to inform, not to force, not to coerce. As nurses, We need to respect the choice, and if ever they still refuse any treatment, we should document this accurately and reflect this in the patient's chart and still continue to provide the care that they deserve. Next, the patient has the right to every consideration of his or her privacy concerning his or her medical care program. This includes physical privacy, for example, during examination. When doing head to toe assessment, we should provide curtains, for example, in the emergency room, or if possible, a private room where the patients can be given time and space, and if possible, also allow one significant other, like the spouse or uh, a parent or their children or one of their children, no? Anyone they trust, no, from the family, to be present when we perform these private procedures. This privacy extends not only during exams. This is also true as we uphold the confidentiality and privacy of medical records. As nurses, we should avoid discussing patient information in public spaces and outside our duty hours. We should also avoid posting anything related to patient care in our social media accounts and in other online transactions we have. As nurses, we should be reminded that privacy is both a right and a reflection of our professionalism. Protecting patients' privacy strengthens trust in nurses and the entire healthcare team. Closely linked to this right is the patient's right to confidential treatment of all records and communication. So this will include the chart, laboratory results, and even verbal reports. All these, as nurses, should be handled with utmost discretion. We should remember that only those who are directly involved in patient care are allowed access to this information. As nurses, we should remember that confidentiality is not optional. Rather, it is a legal and ethical obligation that we should always observe. The next right is the right to a reasonable response when requests are made by the patient or the significant others. Patients have the right to expect that their needs will be addressed within a reasonable time and as long as the resources can provide it to them. So these requests can range from a request for pain relief if the patient is in pain, no, for a request for information such as their status, the results of their laboratories, and even for comfort measures. It is important that nurses should acknowledge whatever requests they have and, as much as possible, to provide them in the soonest time that we can. Even when resources are limited, our responsiveness defines the patient experience. The next right is the patient's right to know the identity of their care providers. Every patient has the right to know the identity of their caregivers. By introducing ourselves, we are showing more than simple courtesy. We are assuring them of our transparency, not only as nurses in the healthcare team, but also of the institution we belong. The next right that we are going to discuss is the patient's right to know institutional relationships. Patients have the right to know the relationship between and among the hospital and other institutions involved in their care. This is true for patients who are part of research studies where third parties, such as pharmaceutical companies or educational institutions, are involved in performing or delivering certain treatments to them. This is also applicable for medical affiliates or referral networks who are part of the management of their care. All these should be explained clearly to the patient. Transparency eliminates suspicion and it ensures truly informed participation on the part of the patient. The patient also has the right to expect reasonable continuity of care. This means that coordinated services, from admission all the way to discharge and even beyond, should be observed by the nurses and the members of the healthcare team. We should communicate effectively during handover, endorsement, and we should ensure that information passed on from one shift to the other or from one department to another is complete and accurate. Continuity builds safety. It also reduces errors, and it reduces problems that we may encounter in delivering care to the patient. Continuity of care also reassures patients and the family members that we are truly invested in their recovery. Next, the patient has the right to examine and receive an explanation of their bill, regardless of the source of payment. Transparency in billing helps maintain trust and prevents misunderstandings. If ever a patient or a family member has questions about the charges in their hospital bill, we as nurses can respectfully respond by directing them to the appropriate department for clarification. For example, we can tell them they can proceed to the billing department to request for a printed copy of their bill for questions about medications. We can direct them to the pharmacy. For bills about their laboratory procedures, we can direct them to the pathology department. Okay? The patient has the right to know the hospital rules and regulations that apply to his or her conduct as a patient. Being informed of hospital policies allows patients to be active participants in care. They're not merely passive recipients of medications or treatments that we provide to them. By being actively engaged, patients become partners. We should educate them regarding visiting hours, infection control and prevention measures, safety policies, and even their responsibilities as patients. In summary, this patient's Bill of Rights is more than just a checklist. The patient's Bill of Rights is a philosophy of care. It protects patients, it guides professionals, it preserves the integrity of healthcare practice. As nurses, we serve as the daily guardians of these rights. We truly become patient advocates when we uphold these patients' Bill of Rights. In every assessment, in every diagnosis, in every intervention, every conversation that we perform to our patients, we should observe compassion. Thank you for your attention, and I hope that we can truly continue to uphold all these rights with pride and heart in every nursing care that we do.